Okay, so welcome everybody. We've got some familiar faces, some new faces. So welcome to everybody. My name is Jane Holdsworth. I'm Area Manager for Solihull and Warwickshire Community and Voluntary Action. So we're known as CARVA for short. And our organisation is very much about supporting and strengthening the voluntary and community sector, including the faith and social enterprise sectors. So we have been running these meetings actually for a year now. So this is, I think we had our first one January 2022, and this is our first one of this new year. So for some of you have been with these meetings from the beginning. For those of you who are new to them, just a little bit of background in that it has been very much about introducing what the ICS is, what the role of the sector is within that, how the VCS is engaged in the whole system, how we work better together across sectors. We've looked at the priorities, the health priorities for Solihull, and we've looked at who would be the representatives for the Dynamic Leadership Alliance or network. So when we do introductions, I will remind you who your representatives are. So and just as a reminder that we are one of 42 ICSs, so we're Birmingham and Solihull, created in July and taken over from clinical commissioning groups. So I'm going to start with introductions. I've introduced myself. We've still got people coming. So I'm Jane Holdsworth, Area Manager for Solihull Community and Voluntary Action. So I'm going to introduce you first to, Evan is saying I can only hear every third word. Is that the same for other people?
I can hear just fine.
Okay. Sorry, Evan. It must. It's something to do with his side of things. Okay, so introductions then. I'm going to introduce you to people sort of active in ICS or in this particular meeting, and then we'll just go round and I'll introduce as I see people on the screen. So I mentioned before, we have this Solihull place-based meeting, and then there is what we call a dynamic network, a leadership alliance. So that comprises Birmingham and Solihull. There are 5 places for Birmingham, 1 place for Solihull, and we have 2 representatives on that group. So I'm going to go over to those 2 individuals first. So Kerry, do you want to introduce yourself?
Hi, I'm Kerry Turner. I am suffering at the moment with a really bad flu, so my camera's off because I look horrendous. So please forgive me. And I'm also the volunteer rep on the leadership Dynamic and Leadership Alliance. Have we actually decided what we're calling it yet?
Kerry, I think it tends to be called both, doesn't it? Dynamic work and lead. I think the idea is it's a leadership alliance, but it has the potential to change according to what the priorities are. Thank you so much for coming in your hour of illness. So that is Kerry, and then over to Chet Palmer.
Hi, good afternoon. Yeah, Chet Palmer from Coalbridge Trust. So Coalbridge have been working in Solihull for about 21 years, and I'm the other representative. So feel free to ask questions. Not that I'll probably be able to answer much at the moment. It's still very much an evolving beast from our perspective, and we do need your input to help kind of steer things in the right direction and to make sure that we're I suppose giving a voice to the sector, especially for Solihull, because there are more Birmingham representatives.
Thank you, Chair. And I know, Chet and Kerry are both very committed to their role and are very happy to hear feedback from you on a collective level or an individual level as well. So thank you both. Just going over now to people who are going to provide a bit of an update for us. So Carol, over to you to introduce yourself. I know you're coming in later.
Hi everyone, afternoon. My name's Carol Andrew. I work for the ICB. My title is Head of Place Partnerships for Solihull. So I'm kind of the one that is looking at how we translate, if you like, what's done at the ICS level down at Solihull Place and make it very relevant to people in Solihull. So lots of work going on at the moment, which I'm going to update you on in a moment.
Thank you very much, Carol. We are lucky to have here Erin Barton, who I did message, but my message managed to get into the junk section. So Erin has just popped on at the last moment. So Erin, I know you're updating us later, but do you just want to introduce yourself?
Yeah, thank you all for having me. I'm Erin Barton. I am a regional engagement manager at Our Future Health, which will be the UK's largest health research programme. We're currently in Solihull, so I'll tell you a little bit more about it later.
Thank you, Erin. Now, I was going to introduce Evan, who came on and could only hear a little bit of the chat, but at the moment, he's nowhere to be seen. Gemma, can you see him on the list?
He couldn't hear very well, so he's decided to reboot his computer. So fingers crossed, we'll have Evan again.
Okay, brilliant.
Be able to hear.
Okay, thank you. And can I introduce, also I was hoping that we would have Stephanie Bloxham from Birmingham Voluntary Service Council, but she's not here either. I'll have a look and see if I've had any messages from her when I get a chance. But just to say that BVSC is our equivalent in Birmingham, and they are leading on the engagement of voluntary and community sector from the Birmingham side, and we're working very much with them. And I'm just like to introduce my colleague who's supporting me behind the scenes, Gemma Smith. So Gemma, would you like to introduce yourself?
Hi everyone, I am the Health and Wellbeing Manager at Carver. I've worked with Carver for probably about 9 years now, and I've got a background in supporting social prescribing in Warwickshire, particularly with the Connect Well programme, which primarily ran in Rugby, and there was a mixture of funding pathways from the primary care networks once they came on board, but also community, county council, and other pathways. So looking forward to hearing what is discussed today, and I'll keep an eye on the chat, so if anybody has any particular issues, then just flag it in there.
Thank you very much, Gemma. So I'm just going to go around now as I see people on my screen. So over next to Sam.
Hi everyone, I'm Sam Bradley, and I'm one of the local services managers at the Alzheimer's Society covering Birmingham and Solihull, along with my colleague Drew Hall-Smith, who's also on the meeting.
Thank you, Sam. Over to Angelica.
Hi everyone, really lovely to be here and to see everybody. So yes, I'm Angelica, and I am an area manager for Place to Be, and we work all across the Midlands. And I'm here with my manager, who's Manjit, who's also the meeting.
Thank you, Angelica. So I'll pass next then to Manjit.
Hi everyone, I'm Regional Director at Place to Be. For those who don't know what we do, we provide mental health support services in schools across the Midlands. And it's a holistic and seamless approach from one-to-ones to group work. And we're starting to establish and grow our region and our presence in the Midlands, particularly Birmingham, and some work in Warwickshire as well.
Thank you, Manjit. And are you working in Solihull as well?
Not at the moment. The way that our services work, we are commissioned directly through schools or funders, local authority funders, education, or multi-academy trusts.
Thank you very much. And over next to Dave.
Hi, I'm Dave Pinwell. I'm trustee, director, board member of a few organisations, primarily Knoll Society.
Thank you, Dave. And can you just say what Knoll Society does?
Yeah, Knoll Society represents the population of Knoll. It's an organisation with about 3,000 members, and all community services are of interest to members of our society.
Thank you, Dave. Over next to Drew.
Hello, everybody. Yeah, my name's Drew Hall-Smith. I'm one of the local services manager for the Alzheimer's Society for Birmingham and Solihull. The manager that used to look after Solihull, Kate Sweet, has actually moved on to manage a different area. So Sam and I are here today to see what this is all about, and then we'll decide which of us is going to come along. We may alternate, but it's really, really good to be here. Thank you for having us.
Thank you, Drew. Lovely to see you too. And over to Jay. Jay, you're on mute at the moment.
Sorry, I do that all the time. Yeah, I'm Jay Chauhan. I'm CEO of Amber Care Solutions. We are a health and well-being organization, CIC company, and we work quite widely in the West Midlands and further afield.
Thank you, Jay. Over next to Sarah.
Sorry, that was a bit tricky getting off mute there. Hi, I'm Sarah Wildman. I'm Director of Development for Mental Health Matters. We currently deliver services in Solihull. We deliver a mental health drop-in and an enablement service that supports people who are in secondary care with either mental health and or neurodivergent. And we've been working in the area since the start of last year. Jane, could I ask if I pass on our area manager's details, if he'd be included in the group moving forward? I know I've forwarded on invites to him previously, but if I could send his email over to you, could you add him in? Because we're going to alternate.
That's absolutely fine. Yeah.
Great. Thanks.
Do you want to, well, either email me or stick it in the chat?
Yeah. Thank you.
Sarah. Over to Eileen, who's wearing a different hat today.
Yes, I am. I also happen to work for Carver, but today I'm representing Transformation in Action. We're a CIC and we have an initiative to support people going through menopause. So we deliver community and employer awareness events. And we are currently sponsored to trial a one-to-one support with NHS professionals to try and low cost to try and take off the load from the overloaded NHS areas.
Thanks, Celine. Over to Brandon.
This is Scott Amenka. I'm the CEO of Care Trust Solihull. We deliver a range of both statutory and non-statutory services to carers of all ages, from as young as, I think sometimes say 5, but usually around 6 is the youngest, up to 96. We've had people over that age, and we are the key carer provider in the borough.
Thank you, Brandon. So your volume is a little bit difficult to hear.
Is that any better?
So say a few more words.
Is that any better?
Yes. Yeah, that is, I think, yeah, that is better. Thanks, Brandon.
Oh, sorry, my mistake.
Okay, over now to Abby.
Hello, I'm Abby Dixon. I'm Senior Partnership Manager at Think Active, which is the active partnership that covers Coventry, Solihull and Warwickshire. So just for those that haven't come across us before, we're a charity. We're funded predominantly by Sport England, and we have a focus around working with other organisations to help support people to be more active.
Thank you, Abby. And Steph, I'm glad you're here. I was going to introduce you earlier, but you weren't here, but glad you've made it.
Yeah, thank you. I couldn't find the link, but I'm in. So yeah, sorry about that. But yeah, I'm Stephanie Blocks. I'm Head of Health and Social Care at Birmingham Voluntary Service Council. So we've been working with Carver around the ICS and the voluntary community sector. So yeah, great to be here today. See you all.
Thank you, Steph. Over to Karen. Karen, you're on mute.
Every time. Hi, I'm Karen Winchcombe. I'm the Chief Executive of Carver, and I work obviously closely with Jane and Gemma on the ICS, and of course Eileen on Solihull matters. And I'm here today to listen in get a good sort of idea about some of the feedback that's coming through in terms of engagement. And my work with Solihull around the ICS is mainly at place level, so anything coming through today also helps inform voice at that level.
And also to say, Karen's very much involved in ICS Coventry and Warwickshire, so it's really good to know what's happening over that side compared to what is happening with Birmingham Solihull. Thank you. So over now to Emma.
Hi, can you hear me?
Yes, can hear you.
Hiya. So I'm the Referrer Engagement Officer for the BBC Children in Need Emergency Essentials Programme, which is quite a mouthful. So I'm actually employed by Family Fund. We work with we're the delivery partner for the Emergency Essentials Programme. And yeah, we are national and provide grants for children and young people who are facing a crisis.
Thank you ever so much, Emma.
Thank you.
And I think that the last person is Anna.
Hi, yeah, so I'm keeping my camera off. So if I turn it on, then you won't be able to see me at all, I don't think, because the Wi-Fi here is awful today. Anna's White from Warwickshire Wildlife Trust. I am the Health and Wellbeing Manager. We cover Coventry, Warwickshire and Solihull. We used to do quite a lot of on-the-ground work in Solihull around health and wellbeing, but due to funding, that sort of dried up a little bit, and we ended up focusing a lot more on Coventry. But I am looking to try and restart some of the programmes we're running at the Parkridge Centre in South Solihull in the near future, to try and encourage more families and adults to access our services and look at how the outdoors can play a role in their wellbeing.
Thank you very much, Anna. Have I missed anybody? That is great. Thank you ever so much for all the introductions, and lovely to see everybody. We're going to now share a presentation with you. So Gemma, if you're able to bring that up for me, that'd be great.
Hopefully you can all see that.
Yeah, I can see it. I hope everybody else can. Can you move me on to the next slide?
You see the next slide?
Yes, that is great.
Perfect.
Thank you. Thank you. So just housekeeping, to mute your mics while other people are speaking. I hope that everybody's sort of used to Zoom, but I know a lot of people use Teams. So just to remind you, there is the chat function at the bottom if you want to put things in chat as we go along. And we tend to share the chat as well as the recording. The reactions place down at the bottom is where you can raise your hand to ask a question, or you can clap people's comments. You can put love hearts. There's a number of things you can do. So that's the housekeeping. So Gemma, if you turn to the next slide for me. So what we're going to cover today, we've done some introductions. For those of you who came to the last meeting, you may remember Carol was going to do an update on Solihull place-based working, and we ran out of time. So we're putting Carol on first of all. We are going to just have a bit of an interaction session around cost of living and health. Evan, hope he is able to come back on to give us an update on the mental health collective. Erin here. Oh, it's just jumped, Gemma, to I don't know what happened there. I'll keep talking though. Erin is going to talk us through our future health research programme. We'll just do a very brief update on the last dynamic network, and then it will be updates from anybody and any other business. So next slide, please, Gemma. So I just thought I would remind people about this because Carol is going to mention it in her update. So the Farers Future Fund is an £18 million fund to support community, clinical and professionally led innovation. So this is for Birmingham and Solihull. So what it will do is fund activities that will contribute to improving outcomes, tackling inequality. Initially, the majority of those will be on a very localised or team-based level, and there is a view that some initiatives will create new ways of working that can be scaled up, adopted across Birmingham and Solihull. If you want to know any more detail about that fund, you can look at the Birmingham and Solihull ICS website. But that's just to remind you what it is before we move over to Carol's update. So Carol, it's over to you.
Lovely, thank you. I think we might have skipped a slide.
Oh yeah, I think we have.
Can we go back one? So it's a slide after the Fairer Futures Fund. That's it.
Yes, that's it.
Fabulous. That's the one. Yeah, so I think a couple of things I want to say before I get into these two slides. One is that things are changing all the time and evolving. And this work is still, although it feels like we've been kind of working towards this for a while, things are still very new. So we are still working through what this looks like at place in terms of how we translate what's done at ICS level, BSOL level down into Solihull. We have now established our Solihull Place Committee. I think we've met 3 times now, and Karen Winchcombe, who is on this call, attends that Place Committee. And at the last meeting, we talked a little bit about what we wanted our priorities to be over the next year. And these are really important. They're quite high level at the moment, but we're trying to do a little bit more. We're going to be doing a little bit more work on scoping them out in terms of what is the Place Committee's role in these priorities, because obviously there's lots and lots of work going on around them. But they've been identified and they're listed there. So children and families, mental health, learning disabilities and autism, community collaborative, which I'll tell you a little bit more about in a minute, health inequalities, and then a number of enablers. And we've listed those enablers as things like community engagement and co-production, digital. So in terms of things like being able to book appointments digitally, but also being able to share information digitally and being able to kind of move into that remote monitoring world around observations and things like that, so that we can use our digital technology really wisely to support people's health. There's also an enabler around estates and how we use our estates more wisely, and how we kind of make sure that we're sharing estate sensibly, and it's not just kind of, this is my building, that's your building, and actually, you know, that kind of, that thinking, I suppose, is the thing that we're working on around changing. And then we've also got an enabler around joint commissioning and finance, and how we work better together across our organisation. So lots of enablers going on. Just in terms of the community collaborative programme, some of you might have heard, and I think Evan will probably talk about the mental health provider collaborative and how his piece of work is supporting that. There is also a collaborative around community services, and this is very much about how all of our community-based services work better together, and it's very much about moving forward on that integration piece. So how does primary care work with UHB, work with the council, work with voluntary sector providers to make sure that people can access services easily, can access services in the right place at the right time, and how teams can come together in a much more integrated way. So lots of work going on there, but again, it's quite early stages for that programme. I think the really important thing to note in terms of what Jane said about the Fairer Futures Fund is that the fund will be allocated based on those priorities. So we'll be looking at projects that will kind of contribute to those priorities, and very much thinking about those enablers as well in terms of integration and community engagement. Process around that is being worked up. And you know, I think everybody will be familiar with this, but you know, sometimes these things seem really easy to do, but once you get into the detail, it's really complicated and things can take quite a long time. But we're working that up at the moment. And can we have the next slide, because the next slide also kind of leads on from that. In terms of the outcomes framework. So what we're also saying with the Fairer Futures Fund is that we would want projects to contribute to delivering on our key high-level outcomes, and I've listed them there for you so that you can get a sense of the kind of, as I say, very high level and broad outcomes that we're thinking about. So these are, much broader than health. We're very much talking about the wider determinants of health, things like people being in well-paid work and school readiness and healthy lifestyles, etc. And I think it's really important to note that one about the bottom two, actually, about how our services work together and how we reduce our health inequalities in that kind of integrated way. So I always struggle in these sessions to kind of think about what's going to be important to you, because there is so much going on, but I hope that's been useful in terms of some headline stuff in terms of the way things are moving at the moment, but happy to answer any questions from anyone.
Thank you ever so much, Carol. Gemma, can we just pause from the slides and see if anybody has got any questions for Carol?
Yes, Kerry, yes, I can let you know that. So the place committee, I can let you know who that membership is. If I send that out to you, Gemma, then you could send that round. That's fine.
Brilliant. I mean, Carol, can you give us an idea of not names, but sort of representation from different sectors on that?
Yeah, so we have Karen, as I say, who's representing the voluntary community sector. And we've got Director of Public Health, Director of Adult Social Care. We've got the Medical Director for Integration, who's also representing primary care. We've got, oh gosh, I'm struggling off the top of my head, but it's that director level. We've got the chief nurse from the ICB, and we've got Andy Kay from Health Watch. So that's kind of off the top of my head. I think that's probably
brilliant. That's good. Yeah, good memory, Carol. Put you on the spot like that. Any other questions for Carol? Thank you ever so much, Carol, for that update.
Yeah.
I just want to check agenda items. Evan, really glad to see that you've come on. I hope you can hear properly now.
Yes, everything's good, thanks.
Great.
And apologies to everyone for the hassles.
Oh no, there was no hassle from our side. So on the agenda, what I had got was a general discussion about cost of living. Evan, for you to do an update on the mental health collaborative, and for Erin to do something on our future health. Erin, just to check with you, is it easier for you to do your sort of input and then go off? I don't want to be keeping you, in the meeting if you've got things to go to.
It'd be great if I could do it now, but if it doesn't work, I can.
Okay, let's do that. If we do that,
brilliant,
and then go to the cost of living discussion, and then to you, Evan. Is that okay? Are you okay for staying for the whole meeting?
Yeah. Yes, indeed, I'm here. Thank you.
Okay, lovely, thank you. So Gemma, is it possible to bring up the presentation again? And it is the I think it's a couple of slides on from cost of living. Yes, our future health, that one. That's it. Lovely.
Perfect. Could I have the next slide, please? I think it's the yellow one. Perfect. And the next one. So thank you for having me today, guys. I've done sort of similar presentations to the Birmingham VCS group. So just here today to tell you a bit more about our future health, which is currently in Solihull. And has been in lots of different locations across the West Midlands already. So despite big improvements in healthcare, we know that a lot of people are still sort of living in poorer health as they get older, particularly sort of suffering a lot of the common diseases that we all know about. So cancer, dementia, diabetes and heart disease. If you go to the next slide, please. And the way that the NHS is currently sort of dealing with this is very reactive. So people are obviously presenting with symptoms quite late into their disease. And what we want to do is try to identify some of the triggers of disease earlier so that we can firstly develop tests to diagnose them sooner, but also develop treatments if we're working out why people are getting certain diseases, and help people live in good health for much longer. So next slide, please. So yeah, a little bit more about what we're doing. So obviously we want to be detecting and treating diseases much sooner. Next slide. So the way that we want to do that is by recruiting 5 million people to join what will be the UK's largest ever health research programme. 5 million is so that we can have a really representative sample across the UK. So we want to be representative based on sort of the UK census. So that's by sex, ethnicity, deprivation, across lots of different factors. And 5 million people across the UK equates to roughly 1 in 10 people signing up. So it's no easy task. Next slide. So we are a collaboration across the life sciences sector. So this slide is just a little bit about who we're funded by. We are funded by industry founding members, so the people that develop tests and drugs for different diseases. But we also work with a lot of affiliate charities. So a lot of the diseases that we'll be able to use this data set to find some of the answers to. So all of those are in the bottom right-hand corner. Next slide. So I'll tell you a little bit about what is actually involved in taking part. So people are invited to sign up. At the moment, they're invited in lots of different ways. So we're working with NHS DigiTrials. They send a letter to people near some of our locations through the post, inviting them to take part. They might also get an invite through Boots. So some of our locations are within Boots stores. So they've been writing and emailing their members. We are just starting to send SMS messages to people that are signed up with an app called My GP, which quite a lot of people are signed up through. So those messages come directly from their GP practice, inviting them to sign up. But anybody can sign up. So we had a very big Media Monday back in November last year, and we got, I think, 40,000 sign-ups that day just from people, hearing about us through the news, local news and national. So anybody can sign up at any time, but those are some of the ways that we're inviting people currently. Another way that we will be inviting people to take part is through NHS Blood and Transplant. So because we want to collect blood samples as part of the research, it makes sense to get those whilst people are donating blood already. If they're interested, they can consent whilst they're at their blood appointment and join the programme that way. So that will be starting later in the year. So what's involved, they have to just register with us and fill out consent after they've read through various information materials, then complete a questionnaire that's about their health. So all the sorts of usual things about exercise and drinking, family history of certain conditions, lifestyle questions, etc. And then they have to attend an appointment. So like I said, we're currently in Solihull. We've got a mobile hub there. I'll tell you more about that in a minute. But at their appointment, they get their physical measurements taken, so height and weight. They get their blood pressure checked. They get a point of care cholesterol test. And those results are given back to them on the day. So if there's anything unusual, they can go to their GP and start to get that looked at. And they give us a blood sample. The blood sample will be used to look at people's genetics, that we can also have that as part of the data set, trying to work out why certain people might go on to get a particular disease. So that's a little bit about signing up. I think that's the last slide. It is. So I'll just tell you a little bit more about how we've been doing in Solihull. So I think we've only got one more week. We're currently, our mobile unit is in the Tesco car park there. I don't know if links will work if I pop them in the chat. I don't know. I'll give it a go. Oh, it will. Perfect. There's a really lovely news story on our website at the moment when one of our features editors visited the Solihull hub and did a sort of day in the life of the people working there. So we're currently at 100% of all appointments booked, and we have been for weeks. So Solihull's been performing really, really well. Lots of people signing up. I think they have about 150 appointments per day and 5 healthcare assistants helping with that. So doing about 30 appointments each. Really, really busy. We're there for another week, but that doesn't mean that you guys can't still help support the programme and stay involved. So I think in the first slide, I think one of you's popped in that we've got an event coming up, which I think is on the 15th of February off the top of my head. It's about an hour and a half. It's just online. And if you wanted to find out more, we'll be sort of sharing our success, it'll be tailored to the West Midlands, so it's across the West Midlands. We've also been to, we've been in the centre of Birmingham, but we've been to Wolverhampton, Dudley, Longbridge. I think we're going to Sandwell next with our mobile hub. So you can come and find out a little bit about the success of the programme so far, but there's also some breakout sessions where we'll talk about how to make sure that, we get a diverse sample and that the whole community has the sort of opportunity to take part. Talk a little bit about some of the sort of barriers and opportunities using a data set like this. Might be particularly helpful to some of you from a sort of health inequalities aspect, using the data set to look at Solihull and the West Midlands, and also look at sort of maybe some of the social determinants of health, try and get a picture of why people are getting certain diseases. Any questions? Realise that was a whistle-stop tour of everything we're doing and very, very quick.
Oh, it doesn't seem like any questions for Erin?
What I'll do is I'll pop the link for the event in the chat, and I'll pop my email there as well, so in case you wanted to get in touch about it. But yeah, anything that you can do to share with your networks, share with anybody you think might be interested in taking part. A really good place to start is, coming along to the event, and we'll be sharing a little bit more about the sort of toolkit of things that we can give to you to spread the word.
Thank you so much, Erin. And there is a slide which says 10th of February. It says
15th
February at 10:30, and there's a link there in that slide.
There you go. I'll pop it in the chat as well. It's free to sign up, and it's online, as I said.
Yeah, thank you ever so much, Erin, for popping in at the last moment. Great.
That's all right. Thank you for having me.
Yeah,
Bye.
Good luck with all your engagement in the event. Thank you.
Thank you.
Okay, so if we just have a little bit of time for discussion about cost of living. So Gemma, we won't put the presentation up yet, but it's just really to understand if there are any themes or issues coming through from you in terms of what you're seeing on the ground with the cost of living impacting on health. And I just wanted everybody to know that there is currently a VCFSE engagement group specifically around cost of living that is run by Solihull Metropolitan Borough Council. It's facilitated by Austin Rodriguez. So organisations come together to share experience at that meeting. There was a meeting back in January the 4th. So just a few things that came out from that, from the notes, that there wasn't yet a noticeable increase from organisations, from clients, with the exception of phone lines for community wellbeing services and Age UK. Prevalence of people needing help with mental health was already a theme, an issue coming through. Act on Energy was providing more outreach. There was some concerns that pop-up food banks might be undermining food banks that provide a whole support package. So that came up as an issue. And there was details of help around energy and details of help around addressing damp and mould in houses, which I think SMBC is going to be doing some more work around. There is also a financial inclusion group, so they also keep a tab on resources around cost of living. So that's what I know from that group, but it would be interesting just to hear if there are any observations about what you're seeing on the ground and sort of feedback from your clients, your service users about how cost of living is impacting. So anybody who wants to give some feedback, please feel welcome. Nothing from anybody. I mean, is there anybody who goes to that cost of living group that has got any feedback from the last meeting?
I went to the last group. The only thing I'd say, thinking about that for them, is number one, some increases in homelessness. I think that I was also talking to someone yesterday who attended that meeting. I think the demands on the hub and on CAB have remained very high, a lot of financial problems. For the carers first, we've seen the first quite abrupt rise in registrations and referrals from adults, which is usually just toddles along, going slightly up. Well, it's now seen the increase it did in the whole of last year by the end of December. So we're a quarter ahead, if you know what I mean. So by the end of the year, we'll probably have a quarter more people registered with us. We have a team meeting today. We just discussed some of the themes that are coming up, but it's still, given how difficult things are out there, we're not seeing a torrent, but we are seeing an increase. And I would say that there's loads of different issues from well-being, financial hardship. We're also picking up potentially the consequences of the excess death figures, which are off the scale at the moment. So in our sitting service, we've lost a couple of people already, and that's a very small project. Only got 5 active volunteers. That's the other challenge we're having, recruiting volunteers, which in itself could be related to partly cost of living because people are needing paid work at the moment. But that's the rise in the number of people who are dying as a proportion compared to before is getting significant, and that will. So we're going to have a lot more carers going through experience of end-of-life care or of bereavement. And so we've set up a small project of training our staff to be able to offer that support to young carers, and the missing volunteer support little package that we've set up to adult carers is there as well. So that's what we're seeing.
Thank you, Brandon, for sharing that. Chet, you've got your hand up.
Sorry, just to mute myself. So across the different areas then, so some of it echoes what Brandon's just said. We're seeing people come to us who want instant help with, and I think Kerry's put this in her notes actually, with things like vouchers and access to funding, which obviously we don't hold as a charity. So I think there's probably a need to, if there's other organisations that have access to it, to vouchers, etc., that they perhaps get in touch and we can refer people on. Unemployed people, we are finding that the employment level is quite good at the moment, and we're finding that the people that we're working with now are the ones with more complex needs and underlying health issues, a lot of anxiety and depression. And of those people that we see, the majority of them are weighing up whether it's still worth them working, given that having an entry-level job still isn't going to pay enough to cover their cost of living. So that's a bit of a challenge for us. From the family hub, we're seeing, it's the challenge now of we're trying to promote healthy behaviours with families, and the families are reverting to buying low-cost foods and saying, well, look, I need to feed my family. I need to provide substance for them, so they will, I just fill them up on whatever I can get my hands on that's cheap. So this is, going to farm foods and buying the biscuits and crisps and whatever's cheap. And if you do go around those supermarkets, the food is a lot cheaper than buying fresh food. So you can see the logic in that. But obviously that's going to equate to health problems later down the line. Those same families have challenges as well around heating and keeping their homes warm. And obviously that's now spilling over into people having lengthy illnesses, colds, flus, coughs. It's more prevalent now anyway. But parents are actually actively telling us that they're not having the heating on at home at all. And so those illnesses where the child would recover or the family would recover within a couple of weeks, we're now in week 4, 5 and 6 with some of those. And of course they then miss school. So if our family hub is located right next to Yorkswood, it's a deprived area. So the head teacher's feedback there is that the attendance rate is very low at the moment, and that's down to cost and colds, and also the cost of travel for some of the people that travel across the borough to attend that school. So it's an outlier in terms of location. It's right on the edge of Birmingham, so it's probably the school the furthest on the edge of Solihull. So they do have a lot of people coming from across the borough and from Birmingham as well.
Thanks, Chet. Not a pretty grim picture from what you're painting.
Yeah, it is, and I think in terms of staffing for us, I'm finding that our staff are trying to have one conversation and try and help as much as possible. And for every box they tick in terms of helping somebody, there's something else crops up and something else crops up. And I think if you add the couple of years that we had with COVID as well, people are fatigued and can't see when it's going to get better. So people have almost accepted a lower standard of living and kind of a new way of just getting by. And it's not health. If we're talking about health, it's not healthy. They're wandering around with baggage and very low positivity. So then it becomes very hard to engage with people in the area to do positive activities. And that has a knock-on effect on things like volunteering for us as well. So we've found that the volunteering rate has completely dropped. People are definitely in the mode of forget everybody else. What about me? I haven't got the capacity to volunteer. I'm struggling to look after myself on my own. And of course, then there's the other people that go to work and because they have to, and they haven't got the capacity to volunteer either because they've been forced to go back into work or take on additional hours. I mean, it's all very anecdotal. I wouldn't have numbers, but we are certainly getting that feedback from intervention workers.
I mean, the anecdotal is really important, isn't it? And you're stressing as well that pressure that it's creating on the voluntary and community sector, which is increasingly something that we're highlighting. And on the slides, there's reference to Steph has sent round an event happening in Birmingham relating to Birmingham VCFSE, just a lot of burnout and stress in the voluntary and community sector because of the support, that intense support there has been around complex needs for such a long period of time. And I think in Solihull that has been acknowledged as well in terms of SMBC sending out sort of information about support required for organisations.
And it's not just the areas of deprivation. So even if I look amongst the parents in kind of, well, we're in a middle part of Solihull, so Alton, we speak to other parents on a regular basis. My kids are at primary school. They've cut back on a lot of the activities that the kids do. So the kids are starting to miss out on things. They've cut music lessons and memberships to gyms and some of those are luxuries, but obviously has a knock-on effect on health and well-being for young people as well.
Yeah, thanks, Chet. And it's hard to measure those things, isn't it? Because they're going to be long-term impact. Yeah,
and I suppose some of those more middle-class families aren't going to advertise widely that they're cutting back and feeling the pinch. They're getting by, but it's that compounded effect of things being cut back and gym memberships, for example, but that is where people go in bad weather for a lot of people to exercise, and they're not necessarily going to go road running. And so I just wonder, whilst we've got our eye on the areas of deprivation, what about everybody else as well? And in that group, I'd include older people. So we've got over 50s who are, so this is probably more Brandon's area than ours, but that people are plonking their kids with grandparents on the weekends because their homes are warmer. And some of those grandparents are saying to us that they don't want, that they're helping, but they can't afford to feed and support those young people that are being given to them for care over the weekends and evenings.
Thanks, Chet, for those observations. Abby, did you want to come in?
Yeah, I was just going to build on what Chet was saying about some of those community organisations. I can only talk around kind of sport, physical activity, voluntary sector groups, but a lot of them haven't recovered from COVID in terms of the losses that they made during that time. And then now for those that don't have their own facilities where they're having to hire community facilities, to deliver their activities, those costs are increasing, which therefore mean that either they've got more costs to absorb themselves off the back of obviously suffered losses during COVID time, or they have to increase the cost of their activity, which then obviously has an impact on what Chet was just describing about families and people looking at where they can cut costs, and they can't absorb an increasing cost of doing an activity either. So they kind of lose out from both perspectives, because they've got increased costs of delivering their service, but then obviously less people being able to either pay at that additional rate or actually be even able to commit to doing the activity anymore.
Thanks, Abby. Kerry, you'd put a few comments in the chat. I don't know if you want to speak to them, or whether we could just read the chat out if you're feeling too poorly.
They just read the comments. That would be brilliant. Thank you.
Okay, I'm just trying. Gemma, can you see the comments to read them out?
So Kerry said, CAB are seeing an increase in the number of people accessing our service, trying to increase their income due to the rising prices. For example, applications for disability benefits, attendance allowance. We are also seeing people coming in for fuel vouchers. And then Kerry also said, if I scroll down, for those organisations offering coffee mornings or warm hubs, we were asked to ask politely if people are attending, are doing so because they are struggling to heat their home. Because interestingly, we are finding it is more about social isolation and people wanting to meet people rather than issues with bills.
Yeah, that's interesting.
Definitely.
Anybody else want to come in?
I think Angelica had their hand up earlier. I don't know whether I missaw that.
Thank you, Gemma. I did. I just checked then referred to, yes, we are working with children and young people in schools, and we are noticing an increase on parents being unable to take their children to school because of not being able to afford traveling, so buses, etc. And I think also what we are seeing is the impact on the children of parental mental health as a result of financial hardship. So just wanted to add that, but I think you mentioned that, Chair. So thank you, Gemma.
Thank you ever so much. I mean, that's hard information to hear. I think it's time for a break. Let's have a stretch, a cup of tea, just a comfort break, and come back and we'll look at some of the resources around cost of living, and then we'll go over to Evan to update us around the real need that there is at the moment and has been for some time around mental health support and what's happening, which is very positive. So back after the break with a bit of a new energy.
What time would you like us back, Jane?
Shall we say 3:05? So 10 minutes to grab a cuppa, and then we'll be back. Hi everybody, hope you managed to grab a cup of tea, etc. Gemma, can you just share the presentation again? I'm just going to flag up cost of living resources and then pass over to Evan.
Yeah, no worries. I just wanted to flag that there were a couple of comments in the chat around people living with dementia, and also that Chet's also said that health across the board will take a hit if we do not do more to promote low cost and free health initiatives. And Drew said, as you can imagine, the current circumstances are particularly hard for those affected by dementia. They're used to having their heating on all day and now find that they don't have the funds to do this. They are less likely to access warm spaces that many organisations are providing. With the rising cost of food, they are also struggling to eat healthy, fresh foods. And Chet reinforced that. And yeah, that's it. So if I share with you the presentation.
Yeah, thank you, Gemma. Thanks for your comments, everybody.
From the cost of living.
It was the next one.
Oh, there.
Yeah, thank you, Gemma. So just a reminder about that SMBC cost of living group. If you are interested in being a part of that, please put that in the chat and we can connect you up. Just some useful resources, and I mean there are so many resources out there around cost of living, and you might identify some that you found useful, but there are those on the SMBC website, particularly for people who are in council housing, on benefits. There is the Solihull Here to Help, which again is very much about kind of help, financial, energy. Don't forget Healthwatch Solihull, because they are that organisation that is trying to get information about health patterns. I know Healthwatch England has already reported on how difficult it is with the rising cost to get dental care. And you will find, you know, the public health resources, things from Royal College of Physicians on Healthwatch. So it's a good source of information and good for us to be feeding into Healthwatch, even if our observations are anecdotal. For our organisation, we keep information on our website and we try and keep as up to date as we can on funding sources for the voluntary and community sector. We know that SMBC is in the process and they will be delivering funding, particularly for organisations finding it difficult at the moment, and that will include funding for core costs. So the next link is very much about the real pressures we know that charitable organisations, community organisations are facing from rising costs, more demand, people giving less in donations to organisations. So what I mentioned before, there is real stress on the voluntary and community sector to the extent, you know, I mentioned before BVSC doing some research and having a research event day for organisations in Birmingham, and SMBC acknowledging the support that is needed for employees and volunteers. So it is a case of really everybody looking after their well-being, because, you know, this is hard, and I'm not in a front-facing organisation, but for those of you who are, you know, there's a lot of distressing stories and observations that you're experiencing every day. I think the last thing I just wanted to mention, the Poverty Truth Network, is something that I came across at an event, which I did find really inspiring. It's the Poverty Truth Commission, which apparently started in Scotland, but the example that I found out about was in York. And it was very much that principle of nothing about us without us. But so I'm just going to paraphrase from their website. Lasting social change only happens when those who experience the struggle participating in generating that change. So it's very much about people experiencing poverty influencing commissioners and change. And it really is a very, very different way of looking at things. And quite a lot of the things that people were saying who had experienced poverty were more about people's perceptions and judgments about poverty, you know, that they're not listened to and judged. And I think that example of the small boy, Awab Ishak, who had the respiratory conditions and you know, his family was not listened to, is a really good illustration of that. So actually listening to people about what changes can be made to make people's lives just that little bit better. You know, often people are told budget better. You can't budget your way out of poverty, but people sort of talked about the, you know, things that would make a huge difference. So people who got new housing don't necessarily have carpets in it. They might have white goods, but they're not plumbed in. So what are the small differences that give people dignity and respect? So very much, you know, commend you to look at the work that is done around Poverty Truth. I believe there is a Poverty Truth Network in Birmingham, and Stephen Raybould at BVSC was going to look into that. I don't know if anybody's got any other comments about resources you found useful around cost of living. But Gemma, if you'd like to take that down anyway. Any other comments, or should we go over to Evan? Okay, so over to you, Evan, to update us on what's been happening in the world of mental health support.
Thank you. So I'm going to attempt to share my screen. Can you guys see a slide?
Yes, we can.
Excellent. So I'd like to talk about the Mental Health Collective and about the Mental Health Provider Collaborative that I know Carol mentioned earlier as well. I'll begin with the collective and position it a little bit in the way it's developed in recent months. It's gone through a rapid evolution in naming. It was the Third Sector Forum. It became the Third Sector Assembly. It was very briefly the Mental Health Collaborative, and now finally it's the VCFSE Mental Health Collective. So I mention that only so that if you come across some of the other names in previous communications, I've emphasized it's all the same thing. And what we aim this collective to be is simply the community for all voluntary sector organisations, voluntary community, faith and social enterprise operating in mental health and wellbeing in Birmingham Solihull. And I'm now going to step through just 4 slides which show the graphics we've got together to use in social media and elsewhere to help encourage other organisations to join. So want to emphasize on this opening graphic that one of the goals is to make sure that by having as many members as possible, we increase the weight that the VCFSE community has in health and well-being more generally, but specifically into the Mental Health Provider Collaborative. And actually that's a good cue to say that this collective is an organisation of bringing together voluntary organisations, and it's if you like, it's by us for us. And although I talk a lot about it in connection with the Mental Health Provider Collaborative, that's been the trigger to do this. But as a community of the VCFSEs, we can do other things as well. So the collective is not only about the Mental Health Provider Collaborative, but the creation of that collaborative has been the trigger for us to do what we're doing. As it says here, the fact that the ICS operating through the ICB is going to establish a mental health provider collaborative gives us a fantastic opportunity to have a louder voice and to participate equally alongside the NHS trusts in the collaborative. And some positive news since we last spoke. On the 9th of January, the Integrated Care Board made the formal decision to go ahead and start the Mental Health Provider Collaborative operating on the 1st of April. So it's in a period of shadow operation at present, and as of the 1st of April, the Mental Health Provider Collaborative will take on a lot of the delegated responsibilities from the ICB. So basically, the collaborative will have a budget and pretty much free rein to spend that budget to deliver the mental health outcomes that we all want. And it's considering the structure of the NHS and the ICSs, it's quite an exciting low level to put this responsibility, not just the budget, but the commissioning. So the Mental Health Provider Collaborative gets to decide the best way to spend the money to deliver the outcomes. In the second bullet, the point that as the voluntary sector, we get a formal role in this in a way that we didn't have before. Three bullet points here gives us the chance to put forward those ideas we need to see, where we see gaps in service, where we see things that need to be improved. As members of the collective, organisations get to vote in choosing chair, deputy chair, and members of a panel. And it's the panel of 10 people plus the chair and deputy chair that sit within the Mental Health Provider Collaborative, as we'll see in a second. And just as it's an opportunity to feed things into the NHS, it's also an opportunity to learn back from the NHS what's happening. Emphasise that it's open to everyone. It's up to an organisation to determine if it believes it's a voluntary sector organisation in mental health and wellbeing. We're not testing that. There's one application we've had which we politely declined, but that was because it was from somebody in private practice and it was a profit-making venture, so that didn't fit within VCFSE. But if anyone's concerned about how do you define what mental health and well-being is, then my answer is you define it. If you think you're operating in mental health and well-being, you're welcome in our collective. And we will have a meeting of the collective probably in March, bit too late for February, but we'll one coming up in the first quarter. March is also an important month. I mentioned that the Mental Health Provider Collaborative is going live on the 1st of April. And one of the things that, if you like, one of the obligations that puts on us is that we have to re-elect everybody involved so that we have a new chair, deputy chair and panel going into the live period. So while we at present do have a chair, deputy chair and panel that we have elected, we will have new elections in March. So anyone that was not a member previously or wanted to consider going forward for any of these roles does have the opportunity in March. And the elections in March will be for 2-year terms beginning on the 1st of April. So when I created this slide, we had 75 member organisations. We now have 82, and the 82nd member organisation is none other than Brandon and the Solihull Carers Trust. So thank you, Brandon, for signing up. So apologies, my figures are slightly out of date here, but at that time, of the 75, 14 said that they operated exclusively in Solihull, and a further 33 said they operated across Birmingham and Solihull, meaning that 47 out of the 75 had some footprint in Solihull. So of course the 14 is now at least 15 because Brandon has since joined, and one of the others that's joined since it was 75 is Urban Herd. So they would increase the 33 to 34. Now I don't know what the correct ratio for all these things is, but I can say with certainty this is much better than we had before. And also that there's lots of scope to increase the numbers. So one of my requests to everyone is to not only to join up yourselves, but to ask your friends to come and we get as many organisations as possible in here. Here's some detail on this slide just to position who takes part in the Mental Health Provider Collaborative. So the Mental Health Foundation Trust is the lead provider. So they are clearly a provider of mental health, but they're also sit as the lead across the collaborative. The Women's and Children's Hospital Trust is in there, particularly because they deliver the Forward Thinking Birmingham service. They're the lead for the Forward Thinking Birmingham service for under 25 mental health care in Birmingham. And there's us, the VCFSE Mental Health Collective. And you can see that the relevant councils, town councils are involved as well. And now here's a big consultants diagram. I wouldn't normally want to share a chart like this in a Zoom meeting because I know that it'll be very difficult to read, but I put it up for a couple of reasons. The big green line in the middle, and I've just put a circle around the VCFSE mental health panel. That lime green row is labelled as decision forming, and it's the heart of how the Mental Health Provider Collaborative will operate. The purple box above is the so-called ESG, the Executive Steering Group, the Operational Management Board of the Mental Health Provider Collaborative. And I want to show that all the rhetoric about the voluntary sector getting an opportunity to take part in a different way is matched by the way in which the governance of the Mental Health Provider Collaborative has been set up. So not only do we sit there as one of the, if you like, governing organisations within the collaborative, but we've been asked as a panel to send a representative to each of the other meetings in the green row. So involved in our own panel, but also alongside all the other operational groups at that level. And on the bottom line, you can see the collective. So the bigger organisation, currently with 82 members, labelled as one of the groups that has ultimate accountability and assurance for service delivery. So, but the accountability bit here is important. the panel is able to speak for the collective and report back to the collective, and it should be a two-way relationship. And indeed, it will be a two-way relationship. But ultimately, it's what we do. The panel is responsible to us as a collective, not to the ESG, and the collective delivers things through individual members. So, final comment I'll make on this chart is it's actually version 14 of the management system. So I will make sure that Gemma and Jane have these slides afterwards, but you can, the bottom left-hand corner, it did actually say version 14 copyright ANHH Consulting. I think if I drew this diagram, I wouldn't put my name on it, but there you go. So just a closing slide. So I'm the partnership lead. I work with Mabel Newman at Living Well on the admin alongside this. Our joint email address is MHC for Mental Health Collective at Living Well Consortium. The membership form to join the collective is a Microsoft form online. I think it's pretty short. Brandon and others who filled it in may wish to comment separately. And I've also put the link at the bottom where you can find a PDF that has the details of all the current members. At present, it shows 79, but by sometime later today, it'll be up to 82, including Brandon and the others that have joined in the last couple of days. And I have a one-page PDF that summarizes what the collective is and what I think the benefits of joining, and I'll put a link into that as well before I send the slides to Gemma and Jane. Jane said at the start, in fact, it was part of her prelude to the break, that the changes happening within the ICS, the ICB, the Mental Health Provider Collaborative offer us very positive opportunities. I hope I've managed to reinforce that. There is both a great need for us as the third sector to be more widely involved in mental health and wellbeing care, and the opportunity with these new structures for us to step up and take that role. It's not going to be easy. It's a change in many regards for us, and it's certainly a change for those we're operating with in different parts of the NHS. But the opportunity is there, and look forward to seeing it develop in the next few months. And happy to take any questions now or later.
Thank you so much, Evan. Do you want to take your presentation down?
Done.
Brilliant. Thank you. You've got a comment from Angelica. This is such a positive step in the right direction. Thank you for sharing, Evan.
Oh, well, pleasure. It's a privilege to be involved in it. Hey, we'll only really know if it works in 1 or 2 or 3 years' time, but the possibilities are there. So let's try and make it work.
Anybody else got comments for Evan?
Carol has also popped in the chat that Carol thinks it's brilliant. Thanks so much for sharing this. It's really positive. So 2 very positive comments.
Evan, I have a question which may sound a bit odd. Where does dementia fit in? Does it fit in the collaborative, or is it frailty?
The dementia fits in within the Mental Health Provider Collaborative.
Great.
Yeah. In fact, I may risk it showing one other slide.
That's brilliant. Yeah.
But yeah, there are several of the 75. I think it was 3 or 4 that were covering included dementia care as part of what they do.
Yes, thank you.
Evan, can I just say a couple of things? One, to add to all the positivity. I mean, it's great, the size of that collective. Great that you have got the governance structure that shows that the involvement of the VCFSE is more than rhetoric. It's actuality, and really good to hear also about the growing Solihull representation, and echo what you were saying. Everybody, you know, if there are organisations that you think could be involved, please let people know. I suppose my other question is, like, it is a challenge for all of us doing engagement, for this group as well as for your group, which the challenge has sort of been given to me from two directions. One, from our national body, is finding organisations saying that they spend a lot of time working with the statutory sector because they feel if they don't come to meetings, they're going to miss out on funding opportunities. So it's taking a lot of time for organisations. So there are a lot of organisations that can't give the time because they may be small, community based. And one of the challenges given to us is, how do we make sure that people who don't come to these Solihull place-based meetings find out about what is going on, particularly around funding? So I guess it's the challenge for us with this work, Solihull place-based, and for you, for those people who aren't part of the collective. And it's just I suppose a general question for everybody: how do we engage people that aren't in the midst of things? I don't know if you have any ideas about that. It's a perennial issue, isn't it? Anybody, any bright ideas? I mean, for us, I suppose it's just communicating through all the channels that we have, to make sure that people, they may not attend meetings, but that they know what is happening.
Yeah, Kerry, aligned to that, has said, is there any way we can publicise the collective again through Carver newsletter, so we can perhaps get more organisations in Solihull on board? So yeah, I suppose it's about going through existing channels and trying to get messages out there.
Yeah, and all of us sort of committing to disseminating those messages to our wider networks. So yeah, thank you ever so much, Evan. Really good to hear all the positive progress. So we back.
Yeah, sorry, just to pick up on that, the positivity is great, and I'm very keen that we get above 100 before we have our next lot of elections. So very keen for other people to join up. Thanks.
Brilliant, thank you. So Gemma, can you please put the presentation up? We're coming towards the end of the slides. So at the last meeting, we looked at priority. We looked at priorities right at the beginning for this group around health, and then we've sort of added to them as we've gone on. So mental health always came up as a significant element, childhood and families. But at the last meeting, there was also that emphasis around high rates of suicide for Solihull, suicide prevention, local bereavement service, alternative to crisis provision, the higher proportion of older people, dementia support, early prevention, open door access to support. There's always again been a theme around data, which came up again at the last meeting around data standards, around sharing. And then since we've gone on through these meetings, we've added communities of interest, disabled people, carers, wider determinants of health, physical activity. That was particularly also in regard to people on waiting lists for things like hip operations, consequences of COVID, and again, data came up. And we added last time volunteering, rurality, mapping investment, including the VCFSE. So our list gets longer by the day. Is there anything that is a gap, or anything you would want added, or just to confirm that these are the right priorities? Just to say that I went to the last task and finish group for the Fairer Futures Fund. So I'm able to have a space at that to talk about what priorities are being identified. And you'd be pleased to hear that within that group, the priorities were very much the same across sectors. So we are all talking about, very similar things. Okay, and any comments, Gemma, or should we move on?
There's no comments on the chat applicable to this slide.
Okay.
Go to the next slide.
Yeah, thank you, Gemma. The next one, I won't spend too much time talking about. I just mentioned that we have the dynamic network that Chet and Kerry go to, I go to also. So we're still working through confirming the priorities, conditions of success. I had to remind myself what other things we talked about at the last meeting. I think we talked about the importance of showcasing what is working well. And I think we talked I'm just seeing Kerry has said we add this one too. Support for information sharing and sharing good practice, we added. We talked quite a lot relating to what Evan has said about what is the governance around this group, where does it link to, what influence does it have. We talked about the Fairer Futures Fund. Steph from BVSC shared the representatives from the group. I think there was quite a lot of comment about, is early help represented in this network? And also the importance of emphasising to commissioners and funders the state of the sector, which is what we've talked about earlier on in terms of more demand, less funds, higher costs, a lot of stress on the sector. Steph, Kerry, you were both at that meeting. I don't know if you want to add anything or whether that sort of summarises issues from your perspective. No, Kerry's not, you're not well to speak, but Steph, anything from your side?
No, I think that kind of covers it, Jane. And I think, as we said, this will just be going through governance next. So we've just got that slight amendment addition to make that Kerry's put in the chat, and we'll reshare it. It'll be going through the governance processes and then looking at how that's taken forward, really. So the aim is to ensure that people on the Dynamic Network, the Leadership Alliance, are involved and part of the structures within the ICS around decision making, etc. So yeah, we'll have the next meeting in March. I'm sure there'll be some more good discussions then.
Thank you, Steph. That's useful. So a chance for updates. Don't know if anybody wants to talk about, any health initiatives that they're involved in Solihull. Brandon, you wanted to come in there?
Yeah, two things. One, we've been doing some work on long COVID with BSOL and with SMBC and with forward carers in Birmingham, and we've been briefed. We've identified it easy. It seems to take so long to do this, but the medical team that has the contact supporting people who are caring for or from the medical point of view, I should say, people with long COVID, and we were doing carers briefings for that team, so we'll then get referrals, which I've been plugging away at for ages, and the numbers have got to go up quite high. But finally we got through with that. And the other thing, it's grim out there, but also my teams had higher morale, actually. Even despite the fact we had quite a few setbacks, and we got some managers off. One just had a beautiful son, that's Gina. That's very nice for her, but she's hard to fill her absence on maternity leave. But my point is that morale in our team is high, and we're very motivated, and that comes from caring about the staff so that they can care about the carers. I'm sure everybody else is doing exactly the same thing. So even though I'm sure some people it is very stressful and demanding, I think this is the fifth recession I've lived through, and we will get on the other side of it, and we will help our carers through it. So I think that upbeat part of our message needs to be injected in there as well. So.
Thank you, Brandon. That's good to know that people are resilient. Anybody else want to exchange any information about initiatives going on? So, Kerry, we've been lucky enough to get a little bit of funding to raise awareness of long COVID. We are, I don't know if that is continual typing or not. Gemma, can you see?
It continues. We are holding 3 events in North Solihull in the next 6 weeks. It would be great if I could share a poster and you put it out within your networks. So yeah, if you want to drop it to Jane or myself, and we can send it out when we send the slides to everybody.
Anything else from anybody?
And we're happy to share as well that we're running some community events around the Midlands and Warwickshire as well on menopause awareness. So I'd be more than happy to send you posters as well in the coming months. They're community events. They're just quite amazing at seeing couples coming to support each other. And especially after the announcements this week, they're very much needed.
Thank you, Elaine. Anybody else? Okay, if there's nothing else, just to say there's a last slide. No need to pull it up, Gemma, but just to say that there was an email that went round from Jacob Stanbridge at BVSC, just asking if anybody wanted to be included in Route to Wellbeing, which is a directory of services. Specifically, there was some funding from the Royal Orthopaedic Hospital. So that is an ask if organisations want to be included within that. But it was just also a reminder of other directories that are out there if you as an organisation want to promote your services. So I mentioned Here to Help, which is around crisis support, cost of living. There's Waiting Room, which is Birmingham and Solihull services. Healthwatch also have got a Find a Local service section. There is an intention from Solihull Metropolitan Borough Council to have one web page where all the directories that they're involved sit, including family information and My Solihull maps. So just to update you about that, and if you do want to promote your services, there are a variety of ways in which you can do that. So if there's nothing from anybody else, we'll call an end to the meeting. Lovely to see you. Thanks for all your feedback. Thanks, Carol and Evan, particularly for your updates, and see you all again soon. We'll keep you updated and in the loop.